We're talking with Dr. Gus Theodos. Dr. Theodos is a BJC Medical Group cardiologist at Missouri Baptist Medical Center about some important heart issues we need to think about. Dr. Theodos, we're a couple months into the new year, a time when a lot of people try and start dieting. And if you're still dieting at this point of the year, congratulations to you. But I wanted to ask you, what are some of the good diets for heart health?
I think in general we want to have a good balanced diet. I think any of the extreme kind of diets that people talk about are usually not great for the heart. I often tell my patients, again, moderation is reasonable, but I usually kind of say things with fewer legs are better, meaning that, fruits and vegetables are probably best for your heart. If you actually were vegan, then your risk of developing significant cholesterol buildup in your arteries is significantly reduced. So I usually say, things with fewer legs. So fruits and vegetables, then fish, then chicken, turkey, then you get into your beef, pork, and then things like shrimp and lobsters have lots of legs, so not as good for you. And again, I'm not saying you can never have those things for a celebratory meal or an anniversary or birthday or whatever, but I think if we can shift our diet towards a little more fruits and vegetables, more fish, more chicken, things like that, I think it's a little bit healthier. I think we want to avoid ultra-processed foods. Obviously, fast foods, things like that. I know it's a big part of the American diet, but if we can, try to eat whole foods and less processed foods, better for us in the long run.
Is there a certain heart diet that you like?
I think people often talk about the Mediterranean diet being kind of, a model of things because heart disease is less there. I think some of that is also activity, right? I think people, in the Mediterranean are often walking more, right? They don't drive as much, and usually they're getting more steps in, things like that. So again, I think it's a balanced diet. I think you want to avoid the processed foods, make sure that you're eating whole foods as much as you can. And then again, activity is really important because the American Heart Association talks about, getting about 150 minutes per week of aerobic exercise. And that really means, where your heart rate's up and you're sweating a little bit. So you can break that down. You can do 30 minutes, 5 days a week. That works. Or if your schedule doesn't allow that, you can actually do all 150 minutes, say on the weekend or something. So I generally, and I think the combination of diet and exercise and medications is really the ideal thing for most people, because people have to be aware of their risk factors for heart disease, which would include things that we talk about all the time, like diabetes, high blood pressure, high cholesterol, smoking, of course, and your family history.
Let's talk about high blood pressure for a minute. You mentioned, you got to know that you've got something going on. I think a lot of people aren't aware they have high blood pressure.
Absolutely. Everyone, certainly once you're 18, you should at least be getting your blood pressure checked once a year with a primary care physician. I think when we're younger, we think we don't have any medical problems. We don't have to check things. And like you said, if you don't know, you can't do anything about it. So I would recommend, even if you go into your local pharmacy and that has a machine and get your blood pressure checked, at least every so often, I think that's a good start. And then from there, once we know you've got an issue, then of course we can work on treating it.
Are there signs that you might have high blood pressure if you hadn't taken any of these tests? What should you be looking for?
It can be challenging because sometimes you don't really know until it gets really high, and that would be things like dizziness and visual disturbances and headaches. Sometimes you can feel, kind of your heart pounding and things, but oftentimes that's not necessarily associated with blood pressure. If you feel your pulse and it's particularly strong, that could be a sign, but everybody's a little bit different because if you're a little thinner, you may be able to sense that a little bit more. So I think, just normal things like making sure that when you're exercising, you don't feel anything that really feels out of the ordinary. You're not having significant headaches and visual changes. You're urinating normally. Things like that can be small signs that the blood pressure is a problem.
I wanted to ask you about pregnant women and heart health. What advice do you have there?
Yeah, so, pregnancy, obviously, we want to protect the mom and we want to protect the baby. I think it's important for pregnant women to remain active. I don't think they need to do anything out of the ordinary. It's not like, you got pregnant, now you need to start an exercise program per se. But I think, getting your steps in, and then, continuing an exercise program, if you're on it, is actually okay. You can continue to lift weights. You can continue to do aerobic exercise, as long as you feel okay and it's not putting too much strain on the abdomen and things of that nature. So it's a trickier subject for sure. There's not a lot of great data related to that, but I think in general I tell pregnant women just to try to remain active.
In summing this up, Dr. Theodos, what do you want people to know about their hearts?
Well, the heart is a really complex organ. It's obviously very important. Heart disease is still one of the most important killers in the country. And so in order to prevent heart disease, we really need people to understand their risk factors, like I mentioned, the high blood pressure, high cholesterol, not smoking, diabetes. So you got to know your numbers, make sure those things are well treated. If you have any concerns or you're feeling anything out of the ordinary, certainly seek medical attention. One of the things we talk about a lot, particularly during Heart Month, is how women can present differently. And so women don't necessarily get that heavy chest pain pressure that men will often get, that is kind of the classic textbook teaching. And so sometimes it's just feeling indigestion or short of breath or arm pain or throat pain. Those things can be signs of heart disease, so don't ignore those things. You'd be surprised how many times a year we get somebody who just said, oh, I thought I had bad heartburn for a couple of weeks, and it was really angina, and so later they end up having a heart attack. So don't ignore things that seem out of the ordinary. Certainly if things are persisting, seek medical attention.
Dr. Theodos, thanks so much for your time today. Really do appreciate it.
Thanks, Fred.
Dr. Gus Theodos is a BJC Medical Group cardiologist at Missouri Baptist Medical Center.